Hello, I'm Steve Teitelbaum and I'm a plastic surgeon in Santa Monica, California. I do a lot of breast augmentation and I think I offer some very unique and special things that I want to tell you about. The first thing is that I'm very interested in your breast augmentation, not just to make you happy in the short term, to give you what you want and to make you look beautiful for the first year. But I realize when you operate on a young woman, what's important is not just how beautiful you are for a year, but for 3 years, 5 years, 10 years, and for the rest of your life. For that reason, when you come to see me, we'll take a lot of measurements of your breast. We're going to assess your tissues, we're going to assess your chest wall, and try to come up with a plan that will make you the most beautiful both now, in the short term, and for the long term. I'm dismayed to see many women think that they can have any kind of breast that they want on their body. And I see large implants forced, shoved, and stuffed into very small spaces. That gives women round, fake, bulgy, and unnatural looking breasts. But worse than that, over time, their skin thins, their skin stretches, the breast implant becomes more visible, and they can become very dissatisfied with their outcome. Similarly, even putting in too small of an implant can create an unattractive result. If a breast is this wide and an implant is too narrow, well then it just looks like a rock in a sock and it's not beautiful. I emphasize education. I will teach you everything there is that you need to know about breast augmentation so that you can decide what choices you want to make in order to have the result that you want. There is no perfect way to do this. There is no one perfect incision. Breast augmentation is about the patient making a series of choices between suboptimal choices. Each choice has some trade-off. Which incision, whether it's the armpit, the nipple, or underneath the breast, whether it's in front of the muscle, behind the muscle, saline implants, silicone implants, smooth implants, textured implants, round implants, shaped implants. There's a reason and a place for every one of those choices. Every permutation between those has a role for some women, and the important thing is for you to decide what the role is for you. You can tell I'm very opinionated. But one thing I promise you is you would never wake up surprised about what I did. You won't wake up bigger or smaller or different than you expected. I'll discuss everything with you ahead of time, and we will arrive at a plan together. I won't do anything different than you tell me you want. But I won't do what you want until I've discussed and taught you everything there is to know about breast augmentation, because if you tell a doctor what you want, but you haven't first been educated about the consequences of each of your choices, then saying what you want is meaningless. So together, if you come in and see me, we can discuss all the issues pertinent to you. We can discuss your tissues, choices of incisions, pocket locations, implant types, and try to meet the result that gets you the results you want. Thanks for listening, and I look forward to meeting you.